Yalimada. My name is Ali Aleda. I'm an OBGYN, and today I'll be talking about breastfeeding. The American Academy of Pediatrics recommends that babies should be exclusively breastfed for at least the first 6 months. Breastfeeding should continue even after the introduction of foods throughout the second half of the first year, and can continue for up to 2 years as long as desired. I recognize that not everyone can breastfeed, and there is nothing wrong with using formula. However, if you can breastfeed, it is recommended to do so. Also, I want to point out, for the purposes of the discussion, when I'm talking about breastfeeding, I'm also talking about pumping in the sense that it is breast milk. There are many benefits for mom: decreased postpartum bleeding, as well as the delay in the resumption of the menstrual cycle. It also decreases the risk for breast cancer, ovarian, uterine cancer, as well as diabetes and heart disease. Decreases the risk for depression, increases bonding with baby, as well as helping with weight loss. For baby, there's less spit up, gas, diarrhea, constipation. They tend to have stronger immune systems with less allergies, eczema, and asthma. There's a decrease in risk of sudden infant death syndrome, and they're also less likely to become obese as adults. Breastfeeding is a new skill for mom and baby, so it's really important to get a good head start. Try to start breastfeeding in the golden hour, which is the first hour immediately after birth. Skin-to-skin contact with baby on mom's chest is really important. The more the baby nurses or mom pumps, the more the body makes, and so supply is based on demand. And you should aim for feeding every 2 to 3 hours. Now, some moms may need to pump from the outset for various reasons, so recommend working with a lactation consultant during your postpartum stay in the hospital. Initially, for the first 3 days, breast milk is colostrum, which is thick, yellow, but rich in antibodies. Some tips or tricks: look for hunger cues in baby: rooting, sucking on their hands, smacking on their lips or tongue. Focus on a good latch, and nursing pillows. Comfort for mom is key. This is going to be a position that mom will be sitting in for multiple times for a prolonged period of time. Nutrition and hydration also is very important. Moms need an extra 500 calories per day to support milk production, so protein bars, smoothies, healthy fats. You need 80 ounces of water. If mom is dehydrated, milk supply will go down. Also invest in some comfortable clothing and nursing and pumping bras. For latching baby, you need to hold the baby close with their nose against mom's nipple. Tilt baby's head back so upper lip brushes against mom's nipple and mouth opens wide. Bring baby to the breast with the nipple to the soft part of baby's mouth and the chin is leading. Now, this should be relaxed and enjoyable and not painful. If the latch is painful, it's incorrect. Some breastfeeding positions. Cradle hold is the most common. You use a breastfeeding pillow. Sit upright, placing baby across the chest, and baby's head rests in mom's elbow, and the other arm supports baby's back and body to bring baby closer to mom's body. Cross cradle is the same, but instead of holding baby in the elbow, you bring the opposite arm and hold baby's head. Back lying is ideal with babies who have reflux. Football hold is a same side hold and helps drain different milk ducts. Side lying is ideal for moms who have had C-sections. How can you tell if baby is getting enough? So you need to focus on full feeding. This means 10 to 15 minutes on each side, and you need to prevent baby from falling asleep. So tickle their foot or their cheek, change the diaper between sides. Mom's breast should feel softer after each feed. Baby will have about 6 to 8 wet diapers and 3 to 4 stools in 24 hours, and mom should be nursing 8 to 12 times in 24 hours. Now, as I mentioned before, some moms may need to pump right away, but the benefits of breast milk are still there. There are many different kinds of pumps, so research prior to purchasing, and many are covered by your insurance, so you need to obtain a prescription from your OB. Start pumping after about 4 weeks to ensure that your nursing relationship is well established. Partner can do a dream feed, which is the 10 to 11 p.m. nighttime feed. Mom does a 10 to 15 minute pump and goes directly to sleep. This milk can then be saved for the next day or frozen. After the first morning nursing session, mom should pump for about 10 minutes. The breasts are the most full in the morning, and you can use this milk then for the evening dream feed. When should you call a doctor? If there's significant pain, bleeding from the nipple, if mom has a lump in the breast with fever, this is more like mastitis and you require antibiotics. If there is a painful hard lump with no fever, this is more like a clogged duct, which requires massage and continued feeding. If mom has flu-like symptoms, this is another indication to call a doctor. For bottle feedings, you need to do pace feeds, especially partner, nanny, and there are multiple videos on how to do this. Hold the baby upright, use a slow flow nipple, and this mimics suckling and breastfeeding. Hold the bottle about 30 degrees. The key is making the baby work for it and not just free-flowing milk from the bottle. There is lots of support out there, friends, family, lactation consultants, locally La Leche. There are online resources. Please reach out for help if you need it. Lastly, there is something called genital urinary syndrome of lactation, which is a temporary menopausal state while you're breastfeeding. If you have vaginal dryness, painful intercourse, poor healing of the perineum, or urinary symptoms, please see your OBGYN. Thank you so much for listening. Yali Madad.